reason that an interventional radiologist can't practice independently in the same fashion as a vascular surgeon or interventional cardiologist is because of exclusive contracts.
You are now listening to Sorel Gaur MD.
Sorel Gaur MD. Interventional radiologists can't practice independently. That's the truth. I didn't even know about this until about 6 months ago, and now I know it's a big problem. Let's say you're an interventional cardiologist or a vascular surgeon. You could put up your shingle on the side of the road, Sorel Gaur MD. You could start admitting patients to the hospital and doing high-value procedures on them. But as an interventional radiologist, you can't do the same thing. And it's not because of a lack of skill. We know it's not because of that. We're getting very good training out here. It has to do with a logistical error that works systematically against interventional radiologists. And I'm hoping that in the future that this error is corrected. And before I tell you what this issue is, I just want to say that I learned about this issue through a very well-written, well-worded forum post in the SIR forums. And I found the doctor's email, so I contacted him, and I'm talking to him on the phone for a little bit, and I learned about this issue. And I suggest if you're interested in getting information, that you do it in this same way. All right? So the reason that an interventional radiologist can't practice independently in the same fashion as a vascular surgeon or interventional cardiologist is because of exclusive contracts. What does that mean? Okay, let's say you're an IR. You set up an office-based lab, an OBL. You have an interventional suite. You're going to need admitting privileges at nearby hospitals. This is a requirement in most states. And strangely, if you apply for those privileges at a nearby hospital, you're going to be blocked from getting them. You just cannot get them. And without those privileges, you cannot safely run your OBL. If you were an interventional cardiologist or vascular surgeon, you would have no problem getting those same privileges. And that is because of this. IR services, IR procedures, are bundled together with radiology services as a whole and sold to the hospital, contracted to the hospital. Okay? Hospitals, of course, as we know, need radiologists. Radiology is integral to healthcare. A hospital is going to have a contract with a radiology group to read their CT scans, MRIs, ultrasounds, and X-rays. All right. The problem is that when that diagnostic radiology group signs for that contract, included within that contract is going to be the services for IR. Okay, things like permcats, kyphoplasty, angiography, and angioplasty. That's all going to be bundled together with radiology services as a whole and contracted exclusively through that group to the hospital. So if you are a IR and you're applying for privileges to do those same IR procedures, you're going to be blocked because they're going to say we have an exclusive contract, a relationship with this group for those same services. And unfortunately, you are out of luck. You could be very well trained. You could be very clinically focused. You could be rounding on your patients, admitting, seeing them in the clinic pre and post, doing a lot of high-level clinical decision-making. You could be very well trained in complex interventions like Y90 and SFA interventions and neuroangiography and kyphoplasty. And you could come out of your training and you could have a very hard time finding a job where you practice 100% IR. Right now, in the current state, there are workarounds for this problem, all right? But the truth is we don't deserve workarounds. We deserve equality, right? We deserve to be on equal footing with interventional cardiologists and vascular surgeons, right? Isn't that the whole point of the IR residency? I think we deserve to practice IR at its highest level, all right? And I think we need to know about this. If you were a medical student, you especially need to know about this because if you're interested in being a radiologist who does procedures, then I think IR in its current form is well suited for you. But if you see yourself as a surgical subspecialist, you see yourself as someone that wants to be in the clinic and then doing cases and that's it, and you think that diagnostic radiology is a complete waste of your time, if you think that diagnostic radiology is just a means to that end of being an IR, then I think you should really strongly consider some other fields where you're not going to have this same problem. Okay? Because you could come out of your training, you could fight through some very difficult match statistics, and you could come out on the other end and be very frustrated and miserable for really no reason. So that is the issue. If you have some more questions, I do happen to know somebody that has extensive experience and information in this arena and does want to talk about it. So hit me up. Go ahead and click like below if you like this video or subscribe for additional content. I'm Sorel Gaur MD. Thanks for watching.